So let's look at each section of the report, beginning with fasting glucose. As we said, glucose less than 100 is normal, and when your glucose is consistently over 126, you're in the diabetic range. So between 100 and 126 is the pre-diabetic range. Now this has become an important concept because we have looked to the question of who is likely to develop diabetes in terms of how high their glucose level is. The higher the glucose level, the more likely someone is to develop diabetes. What you need to know is that at any given glucose value, there's actually a range of risk. Some people at a given glucose have a much lower risk for diabetes. Other people at the same glucose level have a much higher risk of diabetes. This means that diabetes by itself is not a very good predictor of individual risk, and that's why we need more information as you see in this report. The second section of the report focuses on insulin resistance. So let's begin by defining what insulin resistance is. In short, insulin resistance is when insulin produced by your pancreas does not have the expected effect on the tissues where it's acting. And these tissues are your liver, your muscle, and your fat tissues. When these tissues become resistant to insulin, the body compensates by increasing the insulin produced by the pancreas. As your body produces more insulin, you overcome the resistance of the tissues where the insulin is acting. Now, insulin resistance is actually a progressive change over time. Most people are very insulin sensitive, but there are degrees of insulin resistance from mild to moderate to severe. And as insulin resistance worsens, the body will increase its insulin levels to overcome that insulin resistance.